hormonal issues are very important for desire and as far as sexual function in terms of erections, there's only 3% of erectile dysfunction that's related to hormones. So it's actually
but that's pure erectile function.
Correct.
As opposed to desire.
Correct.
Psychological arousal.
Desire is predominantly modulated by the hormone testosterone for both men and women. In fact, a lot of people don't know this, but women have more testosterone in their bodies than they actually have estrogen. So testosterone is very important for both men and women for a variety of reasons. And so using that discussion with the patient will help you kind of identify where you're headed in terms of what you need to focus on for treatment. There are, certain things you can use to assess blood flow. You can do Doppler ultrasounds of the penis as well as the clitoris to see if there is good blood flow. You can assess the peak systolic velocity, which will tell you if there's a problem with arterial inflow, versus the end diastolic velocity, which will tell you if there's a problem with venous outflow. And so that can assess those things. There are some tests you can do for nerve function, although they're very uncommonly done because mostly we can kind of get that through a clinical report. And unfortunately, if you're having nerve problems, sometimes it depends on what's causing them, but sometimes they can be very difficult to reverse. And that's kind of a problem. We know that as people age, their sensation becomes less. So just through aging, the receptors become less sensitive. And so you will generally have less responsiveness to the same sensations you did when you were younger. And so that kind of overlays all of this. So it's complex, but really, a lot of it comes from the discussion you have with your patient or, you kind of really doing a deep dive in what's going on, like really thinking about each of those aspects.